Hi, my name is Anna J Ep.21, and I'm a curious mind who wants to meet interesting people. That's why this show is called Whattaya Say with Anna J. So, should we go and meet somebody interesting? Hey, and welcome to Whattaya Say with Anna J. And guess what? I'm Anna J. Nice to see you again. I hope that you stay tuned because I've got a really great and very interesting guest today. My guest is someone who's absolute forefront of medicine and mental health here in Kelowna. A board-certified anesthesiologist who's been serving patients at Kelowna General Hospital since 2010. She holds an honors degree and a medical doctorate from University of Manitoba, and she's trained extensively in both anesthesiology and medical leadership. She is the co-founder and the medical director of Entheomed, Kelowna's first clinic dedicated to ketamine-assisted therapy, and she's recently been named as one of Kelowna's top 40 over 40 for her groundbreaking work. I'm also honored that she is a girlfriend of mine, and I'm also her dog nanny to her beautiful fur babies, Odie and Milo. Can I introduce my friend, Anita Sanan? Hi, Anita.
Hi, Anna.
Thank you so much for coming on to this in such a kind of, not formal, I want to make it a conversation, but, you know, usually we are in sweatpants and we're talking about something else.
That's true. Having a glass of wine.
Thank you, yes, exactly. But I really wanted to talk with you and to reach Kelowna, because the one thing that I tapped in is the ketamine clinic, Entheomed. Now, a lot of people think of ketamine when I first used it as a club party drug, Special K. Sorry, Mom. But it also was used for anesthesiology and for surgical things. So what was it that brought it now into mental health? And tell me a little bit about that, because I love this.
Yeah, well, for sure, it is all the things you described. Ketamine is used as a party drug. It is used as a street drug. It is used in surgery. I use ketamine in my surgical practice every day.
Horse tranquilizer.
It is also a horse tranquilizer. So it's many things, but it's so much more than that.
Yeah.
So, you know, ketamine came into the realm of mental health many years ago. It was experimented on basically actually in Saskatchewan. So physicians in Saskatchewan are using psychedelic medications for patients in the Mental Health Institute in Saskatoon and Estevan.
Wow.
And they basically found that they had improvements in suicidality, significant improvements in depression and mood. And then, of course, came the war on drugs. And so anything that was considered psychedelically based became completely kiboshed. And so all the research also went down with it at the same time.
Right.
Although there was
so this is around 60s and 70s?
Yeah, so late 60s and the Nixon era, so
Okay.
it all got shut down. And then a resurgence kind of occurred in about the year 2000 where people in the US started really looking at ketamine for mental health issues again in clinical doses. So, you know, the problem is that ketamine in street form or party form is usually used in much higher doses than we would use for mental health issues,
Right.
and as well as in surgical anesthesia. So we use it in much higher doses in hospital-based practice during surgeries, or if we have children who we need to reset bones on, things like that. The dosing we use for mental health is a sub-anesthetic dose, so it's much lower.
Mm-hmm.
It's in a clinically supervised setting, so you know people aren't doing ketamine for mental health in the basement of their friend's house,
Yeah.
where they're having huge doses and in an uncomfortable environment. It's unsafe. They're not monitored or regulated.
So people that don't know, what is ketamine and what does it do for the body?
Yeah, so ketamine has multimodal effects. So I call it a dirty drug because it does lots of things. But how it works.
Well, then I'm a dirty girl. Sorry.
Well, you know, it has lots of effects. So kind of like how we talk about statins or other medications that are prescribed for one thing, but they do a lot of other things.
Yeah,
so
yeah.
ketamine is an analgesic, meaning it affects pain or improves pain control. It's an anesthetic, so it causes dissociation in the brain, so you feel like you're outside of your body. The biggest thing it does in mental health, though, which is different from other medications like SSRIs or typical antidepressants, is it allows, it performs on a specific part of the brain called the default mode network, and that is where our ego exists. So not ego as in, you know, oh, I'm so great. It's the ego that is in our brain that impedes or is part of our higher functioning and it's part of what controls our emotions. So what ketamine does is it allows the brain to separate the emotional part from whatever trauma people have had in the past. So for PTSD, etc., it allows them to look at what event has occurred or what trauma has occurred from a less emotional standpoint.
Right.
And it allows that separation. Now, ketamine on its own is just a medicine. It does that for a short period of time, and then basically the effects disappear. So ketamine,
and where do the effects go? Does it go, do you pee it out? Do you sweat it out?
Yes, so it's eliminated by both the kidneys and the liver.
So is ketamine like a something that it's not a natural, you don't get it from a natural.
No.
It's created in a
It's a synthetic medication.
Okay. That's what I wanted to make sure that we all knew as well. Now, when you started your studies, how did you become interested in? What's the path that you went into to go, I have to do this? Because was it something that you experienced, or did you just find people that were changing?
You know, it's interesting how I got into this, because initially I could just carry on doing
you're kind of a
anesthesia.
straight doctor, you know? It's like, woo, ketamine,
yeah.
you know?
Yeah, it's very bizarre. And I will say there was lots of resistance and pushback from, you know, community, my colleagues, etc.
I can imagine.
You know, because it's definitely a groundbreaking thing.
Yeah.
But the U.S. had started publishing their studies, and there were some studies that were coming out to the forefront early in 2020, 2021, that kind of were pretty significant studies. And then, of course, as an anesthesiologist, we do electroconvulsive therapy in hospital.
Right.
And I have always found that is such an invasive, high resource utilization type of treatment with many side effects. And I've always thought there has to be a better way than this.
Thank you.
And so a study came out in the New England Journal of Medicine just recently that talks about ketamine versus ECT, and actually found ketamine to be superior, equivalent, and maybe even superior to
ECT is?
Electroconvulsive therapy or shock therapy.
Yeah.
Yeah, so we still do that. It's still a standard of care. It's still the gold standard for many people.
I'm gripping because I'm just like, ugh.
It is still the gold standard for many people, and not to knock ECT, because it is effective, but perhaps it's time to look at some alternatives. And so when I came upon the studies, I started thinking, well, you know, I actually had a space in my other clinic, and I'm an anesthesiologist. I use ketamine every day, so I thought, well, who better to try this here than me?
Right.
I can provide medical supervision, and so I kind of followed the studies, and I dose adjusted based on what I thought, and actually I transitioned from using intravenous ketamine. Initially, we started with intramuscular ketamine, which was actually also groundbreaking. So it's just an injection in the arm.
So that's what I wanted to ask. Is it like a pill, or how do you breathe it in? Like, what do you do?
Well, there is intranasal ketamine, which is also approved for use, but it's quite expensive and difficult to obtain. So intramuscular ketamine is a much easier approach for most patients.
So talk me through, if somebody is really interested in this therapy and but they're just scared. Like, do you go into a room on your own? Do you create an environment? Like, talk me through that.
So what a treatment looks like is the patients are assessed from a medical standpoint for their medical history.
Right, so I'm going to come to you and I'm going to go, I want to put me on ketamine now. You're like, whoa.
You can't do that.
Yeah, okay.
So what does have to happen is you need a referral.
Okay.
So you cannot self-refer. People cannot just come into our clinic and walk in the door and ask for ketamine.
Right, right.
Yes, and you do have to have a mental health diagnosis. So again, you can't just be, you know, looky-loos or curious people coming in to have ketamine. There has to be a mental health diagnosis like depression or PTSD, and they must have had to have tried other things. So if you have not tried CBT or have not tried any antidepressants, you may not very well be a candidate for ketamine, because it's not a first-line treatment, and definitely for people who have done other things already. And then basically they'll be referred, they'll go through our criteria process to make sure that they're an appropriate candidate. They see our mental health nurse first to do a whole assessment first. Then they'll see myself or one of the other physicians there to make sure that they are medically fit and appropriate to have ketamine, because there are people who cannot receive ketamine or who have contraindications.
Right.
And then once they've passed that process, they do have to do some homework. So they have some videos that they have to look through. They have to do some mental health work with journaling, etc. They see our own psychotherapist before their first treatment.
Wow.
And then when they come for the actual medicine session, they are in a private room with a nurse with an eye mask and noise canceling headphones. They're in a nice recliner with
And what,
blankets.
do you have music in the?
Yes, so there's music.
Do they pick their own?
Yeah.
Oh, okay.
So, but it's all there's certain playlists that are appropriate for a ketamine journey. So
Okay.
we allow them to choose from those. No one's playing like heavy metal or death metal while
Oh,
having a ketamine treatment. Yeah, it's often
The Carpenters.
yeah, it's very relaxing
Okay.
music, but it peaks at the same time as the intramuscular ketamine peaks. There's a
Oh,
decrescendo. It's all
right.
kind of appropriate for the treatment. And then basically, after treatment's over, they have a ride home. They can't drive.
Right. Of course.
And then within the next 48 hours, they have post-therapy, so post-ketamine psychotherapy. So the psychotherapy component is actually a huge part of the ketamine-assisted therapy treatment.
Right.
The ketamine is really, honestly, just a medicine that can get you to a point, but the real work is done in psychotherapy. So I tell people that, I liken it to going down a ski hill. So you've been in the ski hill and stuck in these ruts that you just keep going down, the same stuck ruts all the time. And what ketamine is like a fresh sprinkling of snow on those old ruts. And if you just do that and you don't have any psychotherapy, you're going to fall back into the same ruts. But the psychotherapy allows you to carve new pathways down that same mountain, so you're no longer in the ruts.
Yes, because I'm learning so much about the brain and how that's why I'm so interested, and I really wanted you to be on the show specifically talking about this. So when they have noise canceling headphones and their eyes, they just go on their own journey,
Yes.
but you're assisted. You don't ask them questions or
No.
prompt them in any way.
No, it's really quite an
Right.
inward journey. Most patients are not very vocal. They would have difficulty actually having a conversation with you. So there's no benefit to doing psychotherapy during the actual medicine session.
Right.
Yeah,
And
it all
how
comes after.
long does the trip last?
About 2 hours.
Really?
Yeah.
Isn't that amazing? Okay, and do they come out of there wanting a glass of water or
Yeah,
or a
usually
meal?
people are a bit groggy.
Yeah.
They'll have little snacks, we have little snacks for them and some water. And then they usually go home and have a nice relaxing evening, so don't do a whole heck of a lot.
Yeah.
Just
So what do you do when you ask them to come home? Do you ask them to journal
Yeah.
or do? Oh,
and we
yeah?
ask them to
Okay.
listen to the playlist again, just because it may trigger some things in their mind or just kind of rekindle some of the things that they have had come up for them. And then basically within the next day or so, they'll have their psychotherapy where they'll do the deep dive into
Right.
what came up for them, what was the experience, how can we change your behaviors, how can we change your thought processes to get
And
you out of this.
So once you've had the therapy after the ketamine and you have the therapy, do you have like your own playlist of how now what happens, or does the PTSD or the trauma seem to dissipate?
Well, most people need more than one treatment.
Okay,
so you
that's-
do need about 2 to 4 treatments to start.
Perfect.
And then people may come for maintenance therapy. So sometimes I'll see people at 6 months, sometimes I'll see them once a year. Everyone's very different and everyone's on their own journey. So we don't have a specific protocolized approach because
Of
it's
course.
not appropriate for every person.
Exactly.
And so basically each individual sort of comes to us with, we make a plan individually for each person.
Right.
But it's not a one and done treatment.
Yeah.
So they do need
Okay.
a little bit of maintenance, and then basically they will carry on with psychotherapy. So I would say, our success rate is about 70% currently. So
Wow.
70% of our patients will either have a 50% reduction in their scores for PTSD, anxiety, or depression, and almost 50% of our patients no longer even qualify for depression anymore once they've done their full.
That is literally a
amount of treatments.
miracle.
Yeah, so there's some really great programs. There's a few on the island that have really, really great success rates and are sort of mirror that.
Yeah.
We just don't have, the same volume as some of the other programs that have.
Well, of course,
because we're
yeah.
still early
Well, it's
stages.
so new, and
Yeah.
so were you surprised by the effectiveness of it all? Like, is this motivating
Absolutely.
to keep you going? Because I know when you're just starting a new business, and it is a business,
Yeah.
of helping people, it can be demotivating, and people are like, what is this? Kind of like my stupid questions. But then once you get to know it, so if somebody's listening right now and they're feeling, I don't know, with PTSD, with any kind of trauma, with mental health, how do you say, I want to do this, let me try this?
Yeah, it's a challenge because, again, there's just not that much knowledge about it. It's still early days. There's lots of skepticism about it. That being said, we're giving ketamine in inpatient settings in the hospital at KGH, in Penticton, in Vernon. Yep. So there is more acceptance through psychiatry, etc., of this medication that's clearly helping people. I think obviously we don't want people just taking psilocybin or taking ketamine in their basements and thinking they can do this themselves. Because that's really not how this works, right? The clinical model is how ketamine is going to be effective for people. Definitely for myself, when I started this, I thought, really? Well, there's some good evidence. Let me just try this and see what happens. If it fails, it fails. If this works, it works. And I have been profoundly shocked by the results myself. So, I did not expect people to improve so much. And I would say some of my most rewarding work, I do a lot of heavy duty work all the time on a daily basis. But some of my most rewarding work has actually come through my ketamine clinic, where I see people over the course of a period of months completely changed. They are different people. Like if I saw them on the street, I wouldn't even recognize them. They've, they're exercising, they've lost weight, they've cut their hair, they've, I have one patient who never left their house but traveled to Japan last year on their own. Wow. I have people who, were on fentanyl patches, who had chronic pain, who were severely depressed, off all their medications, and now are got married last year. So these are amazing anecdotal stories, and obviously that's not the case for everyone.
No, but that's the question that I was trying to find and how to word it, because what have you seen? How have people come back to you and said, oh my God, Dr. Sanan, you've saved my life? Yeah,
I have people who went through 16 ECT treatments, no difference, and then came for 3 ketamine treatments and have had a profound change in their life. I speak to their parents, I speak to their family members who also feel like this is groundbreaking, and it's changing lives.
And is it just like changing your brains?
It's like cracking the nut open of the brain. That's what it's like.
I'm so interested. Okay. Yeah. Well, we got to know a little bit about Dr. Sanan, Anita, and we got to know about her ketamine clinic. And I'm going to take a little break, and then when we come back, I'm going to have 15 probing questions that gets down to the nitty gritty. We're going to crack this nut. I'll see you in a second. Okay, we're back with What Do You Say with Anna J, and I am talking with Anita Sanan, Dr. Anita Sanan, I should say. And we talked about her ketamine clinic. We talked about, basically that was it, because I'm so interested. I just saturated the whole conversation about that. We're going to have to bring you back, and I want to take you back to when you were a girl and all those questions. But I have 15 questions that will really get to know Anita Sanan. Are you ready to be known?
I think so.
Okay. It's not too scared. I know. Probing question number 1. Best sandwich.
Vietnamese banh mi.
Okay, what is a Vietnamese banh mi?
You've never had?
I don't know.
It's Vietnam has a huge French influence, so they use a French baguette, and then they have specific types of pork and various meats in there with pickled cucumbers and pickled veg and very, very spicy chilies.
And where does one get a Vietnamese banh mi?
Well, it's hard to find in Kelowna, but there are some Vietnamese restaurants that do pretty good banh mi here.
Okay, banh mi. Banh mi. Okay, so what's one thing that you own that you really need to throw out?
Med school study notes.
Oh, really? You're afraid to take them out?
I am.
Really?
Yes, even though they're 20 years old now.
I will never read these.
Yes.
But your own notes, though.
Yes, my handwritten notes. Because I also feel pride in my work, and it took a long time to do these, but clearly I don't need them anymore.
I know, but if you go back and just think, wow, is my brain ever amazing? I go back and I find old songs or poems, and I'm going, who wrote this? I wrote this? Wow. Because you forget.
Yeah, I look at all my detailed diagrams of things like the Krebs cycle, things I'll never even think about or look at ever again or need in my clinical practice.
Exactly. But it's in a box in your office. Okay. All right, that's good. What's the scariest animal?
I'm gonna say snakes. I don't like snakes.
A lot of people say snakes. I
Yeah.
don't like them either. Apples or oranges?
Apples, 100%.
Yes. Okay, sorry, I'm not supposed to be
Yes.
biased. Because some people that say oranges, I'm like, oh, great. So, have you ever asked somebody for their autograph?
Never.
Really?
Yeah.
Oh,
I
wow.
don't really meet famous people very often.
Oh. But what about like a really famous, I was going to say Dr. Zhivago. No?
No, I
Not
have
even
never.
Okay.
Yeah.
Wow. You are cool, man. Because that shows like, not phase. They should have my autograph.
Oh yeah, that's what it is.
I'll ask for your autograph. What do you think happens when we die?
Nothing.
Really?
I think that's just it. It's the end.
The end.
The end.
Ooh. What do you think? Okay, no, sorry. Favorite action movie?
Oh. Well, I think Armageddon. Like an older,
The end.
but a goodie.
Yeah,
you
talk
know?
about the end of life.
That was one of my favorite movies. I could watch that over
Armageddon.
and over again.
I remember that film. Yeah. Okay. I'm gonna have to watch it again now. You get one song to listen to for the rest of your life. What is it? Not over and over again. Just like one song. That's it. That's your lot. One record.
Oh my gosh. That's a hard question.
It is.
I think if I'm going to be politically correct, I should say it's my wedding song. Because at least
What's your wedding
meaning.
song then?
It was At Last by...
At last.
Yeah, there you go.
At
See?
last, come along. Yes. That's a good one.
It is a good one.
It's such a beautiful, and it's got so much tonality for the original singer. I'm just
Yeah.
trying to remember. Anita.
Etta James.
Etta James. Yeah, she's just chilling. I love it. Okay. Favorite smell?
My dog's paws.
Oh, Odie, she has the cutest dogs in the whole wide world. By the way, just saying, it's very easy to love your fur babies.
Thank you.
Oh, that, yes, I know exactly what you mean. Least favorite smell?
Poop.
Yeah.
That's an easy one.
Yeah. And we know that, Belle. Okay, flat or sparkling?
Always sparkling.
Yes, always sparkling.
Always
Sparkling apple juice. No, no, sorry.
Or with a little slice of lime.
Yes, please. Most used app on your phone?
I should look at my phone and see what it says, but probably my Gmail app
Yeah.
because I am constantly on email. I would say that's probably the most.
Right.
I'm not a huge social media person, so
Yeah.
I just don't. I don't have a Facebook account. I barely have an Instagram, and I really only started that because I needed a professional Instagram
Of
to reach
course.
people.
Mine
But-
is voice memo.
Oh, okay.
I am always using my voice memo, and then I hardly go back to it. But then when I do, like I said, that's my voice. Did I write that?
Yeah.
Wow, that's profound. Okay. Describe the rest of your life in 5 words.
Oh my gosh.
And that's 3 words.
The rest of my life in 5
It doesn't have to be a
words?
sentence. It could be
Okay.
like vivacious.
Okay, let's see. Travel,
Yes. Oh, yes.
love, kindness, compassion, joy.
That really is you. Yeah, and for somebody who knows this woman personally, that is absolutely you. Compassion and joy. I love that. What number am I thinking of?
7.
No.
Okay.
Someday somebody's going to get it right. And last question. Do you think that Kelowna needs a new performing arts center?
100% yes.
Good answer.
That's an easy one.
Oh, thank you. Because a lot of people fight this one and I think it's getting easier and easier to answer. Yes.
Well, we're
Because it's
growing as a population so much, and that's a key component that I think is missing in the community.
Exactly. I was speaking to Maxine DeHart a while ago, and she said that, because I talked to her about the rec center, she goes, well, that'll be more of a wellness center, but the new arts center will be like a wellness center for the arts. And I thought, I love that.
Yeah.
Anita Sanan, thank you so much for spending time with me in front of 3 cameras, but that's all I have for today. Thank you so much for watching the show, and we'll see you soon on What Do You Say with Anna J. My name is Anna Jackson, and this is Dr. Anita Sanan.
Thank you.
Bye.